Hi, this is Swati, Assistant Professor from SNS College of Pharmacy and Health Sciences. Today we are going to see alpha adrenergic blockers, which is coming under the sympatholytic agents. So first we will see alpha adrenergic blocking agents. What is meant by alpha adrenergic blocking agents? These are going to act on skin, mucosa, intestine, lungs and kidneys, which is going to prevent vasoconstriction. Effect of these agents will be dilation of arteries and veins and decreased blood pressure, pupillary constriction and increased motility of the GI tract. It will activate reflexes that oppose fall in BP, which are fluid retention and increased heart rate. It is going to prevent alpha medicated contraction of smooth muscle in non-vascular tissues, and it is useful in treating BPH, which is going to inhibit contraction of muscles in prostate and bladder. It is a mini prazosin, hydrin, terazosin and cardoxazine, and these two are longer acting than mini prazosin. Examples. Now we are going to see examples. And next drug is used in BPH, which is going to produce smooth muscle relaxation of prostate gland and bladder neck, and is going to minimal orthostatic hypotension. Next drug is used for vasospastic disorders, pulmonary hypertension in newborns, and it is also can be given as subtypes Q, that is a subcutaneous, intramuscular and intravenous administration. Next, what are the indications for the use of alpha blockers? Means for hypertension, BPH and in vasospastic disorders and persistent pulmonary hypertension in the newborn. It is useful in treating pheochromocytoma. It is used in Raynaud's or frostbite to enhance blood flow. And here the picture shown is the alpha adrenergic blockers drugs available in the market. Next, we are going to see the first drug in alpha adrenergic blocker is tolozolin. Tolozolin means it is a imidazolin derivative, which is a competitive alpha antagonist. It is a affinity for that is it is having a binding affinity for both alpha 1 and alpha 2 receptors. Mechanism of this is it will causes vasodilation by directly acting on the peripheral vascular smooth muscle and indirectly by releasing endogenous histamine. It is going to block alpha adrenergic receptor moderately and agonizes histamine. It will be reducing pulmonary arterial pressure and vascular resistance. Next, coming to the uses, it is used as vasodilator for stimulating heart and for stimulating heart, causing mydriasis through its sympathomimetic effect. And it is also used for treating Raynaud's disease and cerebral vascular accidents, for treating persistent pulmonary hypertension in newborn and for pulmonary artery abnormalities. See the structure of tolozolin. It is synthesized from the parent compound benzyl cyanide. It will give the intermediate, and again it is going to react with ethylene diamine. You will get a tolozolin structure. Next, we are moving into the phentolamine structure. So this is a group attached. The group attached to the imidazolin ring decides whether it will be an agonist or an antagonist. Two imidazolin antagonists used therapeutically are tolozolin and phentolamine, and these both are competitive blocking agents. Mechanism of phentolamine is it is going to relax muscles and widens blood vessels by competitively blocking beta adrenergic receptors. And widening of blood vessels lowers blood pressure. The effect of phentolamine on alpha adrenergic receptor is temporary, and its blocking effect is also incomplete. It is going to antagonize the response to circulating epinephrine or norepinephrine more effectively, and it is used for diagnosing pheochromocytoma It is administered immediately before or while conducting pheochromocytoma surgery in order to prevent or control proximal hypertension, which is due to anesthesia, stress, or operative manipulation of the tumor. Next, we are moving to the phenoxybenzamine. Phenoxybenzamine is alpha adrenergic agonist with long duration of action. It is used as an antihypertensive and as a peripheral vasodilator. For treating pheochromocytoma and Raynaud's syndrome, it is also used during shock and force bite for increasing blood flow to peripheral tissues. Next, moving to the prazosin structure. Prazosin is a derivative of quinazoline and is highly effective antagonist of alpha-1 receptor. It is going to inhibit the postsynaptic alpha-1 adrenoceptors. Peripheral vasodilation occurs because the vasoconstrictor effect of circulating and locally released catecholamines get inhibited. It is used in hypertension, symptomatic benign prostatic hyperplasia, severe congestive heart failure. It is also used alone or with beta blockers for preoperative management of the signs and symptoms of pheochromocytoma. Next, moving to the dihydroergotamine. It is 9,10 beta dihydroderivative of ergotamine. It is majorly used in migraine disorder, which is due to the vasoconstrictor activity. It is used for treating migraine headaches and cluster headaches sprinchers. Next, moving to the last alpha adrenergic blocker is methotrexate. It is an ergot derivative related to lysergic acid diethylamide. It antagonizes serotonin effects in blood vessels and gastrointestinal smooth muscles and also consists of a few properties of ergot alkaloids. It is a serotonin antagonist which is going to act on the CNS and causing vasoconstriction by directly stimulating the smooth muscles. It is used for treating vascular headache. Thank you.